afternoon, everyone. My name is Erica Haller-Stevenson, and I am the Senior Program Analyst for Chronic Disease Prevention at the National Association of County and City Health Officials, where I focus on chronic disease and tobacco.
Good afternoon. My name is Diana Koslasik, and I'm the Senior Analyst at the Association of State and Territorial Health Officials, and I also focus on tobacco and chronic disease prevention. We would like to welcome you to today's interactive webinar, Creating and Enforcing Tobacco-Free Environments at Colleges and Universities. This webinar is the third of a series of webinars that ASTHO and NACCHO will be offering this year on current and emerging topics related to tobacco control. Early adulthood is a key stage in determining a person's lifelong use of tobacco products. One effective way to prevent the behavior is to establish tobacco-free policies where these adults spend much of their time at colleges and universities. Such policies also create a healthy environment for the campus workforce and visitors. Today's webinar will focus on the implementation and enforcement of tobacco-free policies by different types of institutions, the legal implications, and how you can be involved in the effort. We will introduce each of our speakers before they present on the call today. All phone lines for participants have been muted during this webinar. If you have a question for one of our speakers, please post it to the chat box on your screen at any time during the webinar. These questions will be used during the Q&A after today's presentation. At the conclusion of the webinar, you will be directed to an evaluation survey. Please take a few minutes to provide us with feedback on today's webinar. We do look forward to hearing your comments. Also, a recording of this webinar will be posted to the NACCHO and ASTHO website in the next few days. These sites are available on our last slide.
We are joined today by an esteemed panel of experts who will be telling you individually more about their specific role in tobacco control or higher education. Before each speaker, we will be providing a brief introduction. We anticipate that there will be many questions for our speakers, so we have made an effort to allot time for that at the conclusion of the presentation. We are joined today by Maureen O'Brien, who is a staff attorney with the Public Health Law Center located in St. Paul, Minnesota. Maureen works with the Tobacco Control Legal Consortium to provide legal technical assistance to public health professionals and organizations, legal professionals, and advocates throughout the United States. Before joining the Public Health Law Center, Maureen was an assistant city attorney for the city of Madison, Wisconsin, where she drafted ordinances and provided legal advice to the Common Council, prosecuted civil violations of the city code, and provided advice and legal representation to the local public housing authority and city planning department. She received her JD from the University of Wisconsin Law School and her BA from Boston University. We're thrilled to have Maureen O'Brien with us today. Maureen, I turn the controls over to you.
All right, hello. My name is Maureen O'Brien, and I am here to talk a little bit about some legal issues for tobacco-free policies on campuses. I'm from the Tobacco Control Legal Consortium, and we are a legal network working for tobacco control policy change. We serve advocacy organizations and coalitions, federal, state, and local government attorneys, private attorneys and individual citizens, CDC grantees and project officers, and other public health professionals. Basically what we do, we are funded by grants to provide free legal assistance to the tobacco control community. We have just a few people who work to help tobacco control efforts throughout the country. We provide research, analysis, some policy drafting, and help with implementation. And we create resources for others to learn about tobacco control. We don't provide direct legal advice, and we don't go to court to represent anyone. So you would need your own lawyer for that kind of thing, but you can call us, and a lot of times we can help give you some information at the front end so that you can know what kind of questions you might need to ask your lawyers if that came up. So tobacco-free campuses, this is a growing movement nationwide. If you can see that we have some information from the Americans for Non-Smokers' Rights up on your screen. It looks like 938 campuses are 100% tobacco-free. Tobacco-free campuses are recommended as a good policy for reducing tobacco use by youth by the American College Health Association. So what are some of the benefits to a tobacco-free campus policy? Well, one is it could help smokers quit. It could help reduce initiation rates, so it could help reduce people from starting smoking. It could reduce the health risks of tobacco, as well as reduce employee health care costs, increase employee productivity, and reduce campus litter. So what are some elements that we have to think about when we think about what is a tobacco-free campus policy? Generally, a policy is going to cover the who, what, where, and when. So for example, who. If you're thinking about a policy that's going to talk about tobacco control on campus, you think about who does it cover? Does it cover students? Does it cover your visitors? Does it cover your employees? And does it cover your contractors? Thinking about what. One of the important things you have to think about is, does it cover all of the different tobacco products? And usually that can come with being very careful about what definitions you use when you're talking about specific products. The pictures I have up here sort of illustrate that tobacco is a lot more of a varied group of products now than maybe it was in the past. And so you have hookahs and e-cigarettes and roll your own tobacco and a lot of different things that you sort of want to think about. Is that included in your policy? And then where? Where is the policy going to apply? This is sort of one of your bigger questions. If you're thinking about indoor and outdoor, okay, that's the first step. But what about outdoors that's indoors, like inside of a vehicle that's sitting on campus? What about roads and sidewalks that pass through the campus? Maybe there are public roads that go through the campus, and the question sort of would the policy apply to that area? To a certain extent, maybe that would be a university policy that could cover students and employee behaviors both on and off campus, but for visitors it might be a little bit more complicated. The other thing you would want to think about is a shared space, if there's a rented space. Or what about off-campus events? Would a tobacco control policy apply when the students are off campus but at a very clear university or college-supported event? So if you think about maybe athletes, likely there is a code of conduct that already outlines the appropriate and inappropriate behavior by athletes when they're at an away game. So maybe tobacco use could be included in that sort of policy. And then the other thing you want to think about is neighbors. How is this policy going to affect neighbors around the campus? And then finally, what are the questions about when? Communication is really important. You want to make sure that people know as far in ahead of the policy going into effect when it's going to take effect, and have people have time to adjust, to start working on their quit efforts if that's what they're going to do, and learn how the rules apply. Let's see, one of the ideas maybe would be to take a survey of the student body. I know that one campus had a survey saying that most of their students didn't use tobacco, and the ones who did use tobacco were trying to quit. So that sort of information can help explain kind of the community-supported reason for a policy. The process to adopt a policy is going to depend kind of on the individual campus, but it helps to identify your community leaders as well as the decision makers. Policy change might have to come from multiple sources, and it's best that it's supported by multiple different groups so that it can be something that you have a lot of buy-in from a lot of the groups on campus. Now, a couple legal issues that we might see. The first word up there is preemption, which basically talks about whether or not the college or university has the power to decide for itself what happens on its campus. Usually this is true. Usually a university and a college does have that power, but you want to check state law to make sure that it doesn't sort of get in the way of that decision making. Likely this is something that you can research relatively easy, but you might want to check with a lawyer. It can also be sticky when you're talking about, like I said earlier, the roads that pass through the university may be public, they may be private, and you kind of want to see what rules can apply to that situation. Then you want to think about existing contracts. Are there existing contracts with store vendors or for campus events that already include things like tobacco sales or advertising, industry sponsorship of concerts, or any tobacco industry funding of research that's going on at the university or college? You may want to look at any employment contracts. If you have unions, there may be union agreements that specifically apply allowing for a smoke break, and you may have to bargain to change that. Let's see, joint use facilities. If you have a facility that you share with another group, you may have to discuss with them how to change policies. And enforcement, sort of a question of who has the authority over which group of people you're working with, if it's enforcement through an employee policy or through a student conduct policy or through your campus security based on just visitors who are coming. And finally, you're going to want to know sort of what the borders are of the campus so that you can see where, exactly where the campus land extends to. And let's see, so we have publications. I just wanted to point out, if you want to check out our website, we're at publichealthlawcenter.org, and we have a lot of publications that can be helpful for you. If you have any more questions, here's my email address, and I will turn it over.
Thank you so much, Maureen, for your comments today. We really appreciate you sharing the foundation that's needed for this work, some of the common legal issues, and the process for establishing a policy. We would now like to introduce our next speakers from the state of Oklahoma. Rachel Schreffler currently serves as the Coordinator of Health Education at University Health Services at Oklahoma State University. She also serves as an instructor for Health and Human Performance courses in the College of Education. Mrs. Schreffler has been employed by OSU for 19 years, and she began working with the Tobacco Control Program at Oklahoma State University in 2006. Dr. Carrie Pratt has been a health educator at OSU for 9 years. Her major areas of responsibility in this role include peer health education awareness events, and health education research. Dr. Pratt's educational background includes a bachelor's in health promotion, a master's in health and human performance, and a PhD in educational psychology with a focus in higher education administration. Dr. Yvonne Silzeme became the Oklahoma Department of Mental Health and Substance Abuse Services Behavioral Health and Wellness Manager in 2012. He worked at the Oklahoma State University as a health educator. Dr. Silzeme has extensive management, technical assistance, global clinical and public health, and preventative medicine experience. And for over 15 years, he has designed, implemented, and assessed programs related to maternal and child health, public health policies, and behavioral health and wellness. Dr. Silzeme earned a Master's of Business Administration, Health Administration from Oklahoma City University. He has a postgraduate certification in Leadership Strategies for Evolving Healthcare Executives from the Harvard School of Public Health and earned his medical degree from Autonomous University of Guerrero in Guerrero, Mexico. Please remember that if you have a question for one of our speakers, please post it on the chat box on your screen at any time during the webinar. Rachel, Carrie, and Ivan, I will turn it over to you all.
Great. Thank you so very much. And we're going to be starting right now. The implementation of the Oklahoma State University tobacco policy was driven mostly by students. Here we have a picture of our Student Government Association Senate with our Vice President in the middle of it. And now, in October of 2006, one of the Student Government Association senators had the idea to have a tobacco-free campus policy, and she took it to the Student Government Association, where a vote was carried out with 21 yes and 9 no. A month later, the same idea was taken to Faculty Council, where the idea barely passed with 13 voted in favor and 11 against, and 2 voted absent. We did have strong support from Staff Advisory Council. We have 21 voted yes, 0 against, and 1 absent. Now, once we have all the votes that we needed, in December of 2006, the president that we have at this time, Dr. David Smidley, convened a task force to study policies and implementation all over the U.S. Now, the difficult part of that was, at this time, we did not have any university except University of Indiana that has a similar campus size to Oklahoma State University. We did contact them and get some information about how they went tobacco-free and what plan they have. And later on March 2007, our task force comes with the recommendation to have a tobacco-free campus policy by July of 2008. The bad news was, in March of 2007, our president resigned. However, that gives a great opportunity for the new president to take the leadership with what we have. She did. Now, one of the questions that we have, since we have recommendation to pass a tobacco-free campus policy, what does that mean? We wanted to prohibit all tobacco products all over campus. And we wanted to eliminate sales and promotion and marketing and sponsorship of any activities from the big tobacco company. One thing that was really hard was to turn down any funding from any tobacco companies. Now, we have some key issues that we did have to address, and it's a long list, and we're going to elaborate on that when we go to the next slides. One thing that was very interesting was, do we want a smoke-free campus or do we want a tobacco-free campus? And most people were thinking that the good idea we would have a tobacco-free campus, and this is what we did. And the other challenging question for the university was, how many smoking areas that we're going to have on campus? We thought we would have 5 designated smoking areas. However, we think, okay, if we're going to have 5 designated smoking areas, we're not going to have a tobacco-free campus. With the new president that we have, he said, okay, let's go ahead and have 1 smoking area, and we have to phase it out after 12 months. And this is exactly what we did when we set it in a far away limit of the campus. That was in an area where we have married students. And we wanted to make sure that this area was far away from where we have a lot of transit. Now, what did we want? We wanted to have support from powerful organizations on campus. Number 1, students. Number 2, faculty, and later on staff. And any powerful student organization on campus, we wanted to have some buy-in from them. But the most important thing was to have support from faculty and students. Here are some tips that we may use if you plan to implement a tobacco-free campus policy. First of all, you need to collaborate or work with any powerful student organizations that you have on campus. For Oklahoma State University, we work with the Student Government Association Senate, and we find out how the process works for them. If we're going to meet with them, we have all the questions prepared, and we know the formalities, and we identify some key allies within the Senate Association. That gives us an opportunity to know the vote before they even vote on the issue. That was something that was very instrumental on passing the policy. One thing that the Oklahoma State University did was to promote the policy in a very positive way. What do I mean by that? At this time, we have the plan and the vision to make Oklahoma State University one of the healthiest campuses in America. Now, what we did, we tied every message, any marketing, to that same idea of becoming America's healthiest campus. Now, that eliminates any question for constitutional right for smoking, minority group, and one of the questions that we have at this point was, how do we enforce the current policy? Now, what Oklahoma State University did at this time was to create some enforcement plan to make sure that we have high compliance, because we cannot talk about a successful tobacco policy if people do not comply. What we did, we empowered every single student on campus and make them use basic peer pressure to encourage everybody to abide by the policy that we have. And by the other side, we also have what we call enforcement committee that we have with legal system, HR, campus police or safety, and we do have representatives from the task force that participate in the initial process of the tobacco-free campus policy. We wanted to provide wide support to smokers and especially to students. We have free medication available because of a grant that we have from the tobacco settlement here in Oklahoma. We provide nicotine replacement therapy, and we did provide as well prescription medicine. One thing that was really interesting that we did was to work with our student health insurance company to cover medication for any student who would like to get cessation medication. And we did offer also some help through the Oklahoma Tobacco Helpline. Now, with a tobacco-free campus in place, we wanted to find out who the smokers are so we can also offer medication to them. Now, what we did, we screened for tobacco use. Every student that comes to the University Health Services was screened using the 5 A's. And we have a wonderful medical staff with 8 physicians providing medication to whoever would like to get help with quitting smoking or quitting tobacco use. This is the form that we use. That was a very simple form, asking question about willingness to quit tobacco use. This form will be available online as well. Now, what does the policy say? That was the intent of Oklahoma State University to promote health, well-being, and safety to all students, faculty, and staff, and visitors as well. Now, this made our policy easy to promote because everybody wanted to see this as well. So we did provide information about the meaning of tobacco use with all the different forms of tobacco, and later on we did include e-cigarette as well because that was a little bit controversial on campus. One of the questions that you may have with all of this, would you have any disregard for the policy? Probably we would. Now, what we did at this time, we used courtesy and consideration. We did not need any retaliation, anyone who is a smoker. For someone who was a student, if you are not complying with the policy, we can refer you to the dean. If you are staff, you can be referred to director or any manager at all. And we communicate our policy through news you can use, HR, and any other means that was available. Now, something that was really interesting, we have a 3-step action. Number 1 was to politely inform the offender about the policy that we have. Number 2 was to hand them this little beautiful card that you see on your screen to remind them that we have a tobacco-free campus policy, and we do offer some help to them. And number 3 was to refer the offender, if needed, to the appropriate channel. Now, we did have some additional possibilities as a confidential reporting system, and you can call the human resource, and we also collaborate with custodians on campus to report any high volume of cigarette butts that they may have seen on campus. And once in a while, the police may go ahead and patrol this area to make sure that if anyone would be in violation, they would know that police are close by. We could take pictures, and we did not have to take so many pictures for a reason of non-compliance. Something that was very interesting that the Oklahoma State University did, as we move with compliance on campus, we wanted to set the stage statewide. We work with state legislators to write the House Bill 2748, making it effective on November 1st of 2010. that any university that has a tobacco-free campus policy, if we have violation of the policy, the violators can be charged from $10 to $100, and that was a statewide bill that was approved by our legislators. That makes it very interesting because not only universities that have a tobacco-free campus policy, they would not have to fight with smokers that would violate the policy that they have in place. It makes it like a state issue. You are violating a state law by smoking in a campus that has a tobacco-free campus policy, and that's exactly what we did. Now, something very interesting was what happened with the implementation of the tobacco-free campus policies at Oklahoma State University. We did some study to find out what's going on with the policy that we have in place. We look at data from freshmen, sophomore, and junior and senior as well, and we see some significant decrease all over the different student level. And something that was really interesting as well was a little increase on tobacco use from junior to sophomore. However, all other groups, we have seen significant decrease from 2007 to 2008 and from 2008 to 2009. And I don't know if Rachel and Carrie, do you have any comments that you would like to add?
I think just a few comments very briefly. I know we're running a little short on time for our section. Certainly can take questions later. In terms of lessons learned and some key considerations, one, I don't think we can minimize the importance of having that student support. This policy, as Ivan mentioned, was originally driven by student organizations such as Student Government Association. It was supported by Residence Hall Association. And so when we did have that transition in our executive team here at OSU, there was still solid support on the ground, regardless of who might have come into those important positions that are critical into the implementation or approving, I guess, of any type of policy on campus. So can't minimize the importance of student support, having those key players at the table. Also, couldn't minimize probably the importance of not only when you're developing the policy, as most of you know, it's not simply about creating a policy. We can do this for a number of different reasons, but also considering things such as health education. If we're going to create a policy that prevents tobacco use on campus, first of all, what are we going to do to help communicate that to students, faculty, and staff, but also what type of health education and awareness opportunities can we provide to those students, whether they're tobacco users or they're supporting the cessation of other tobacco users, as well as including when developing policy, what will be in place to help with cessation. I think it's critical that those measures are available for those who may choose to stop using tobacco products. The other thing is just as maybe an FYI again briefly, something that came up when we were beginning the implementation and the policy, probably the very end of the development, is that we actually had a healthcare provider that presented a prescription, if you will, for a faculty or staff member to actually use tobacco products on campus. So that was something that was a little bit surprising. So one might become aware of any issues such as that they may need to address when you're talking about or considering locations on campus. Might there need to be, due to a medical reason, an individual that uses the tobacco products? And finally, I'd also mention as having a plan in place to address any issues that might impact adjacent properties to your campus. We don't want to promote tobacco cessation policies and then move a problem out to our neighbors who are adjacent to the university. So those are factors or lessons learned that we had to address after implementation of the policy. And I think that's really all that I had to add to that, Ivan.
Thank you so very much. Carrie, do you have any comments that you would like to add?
Thank you. The only comment, this is Carrie Pratt, the only comment I would want to add is just, as Rachel and Ivan mentioned, not hesitating to involve your student body. And the multiple tobacco health education programs I would give out on campus to different student groups and academic classes, the overall just continuous perception and comments that I got back from students was not a negative attitude towards the cessation or the tobacco-free policy, but they were more concerned about how can we help enforce this. Because if we see other fellow students walking across campus still utilizing tobacco products, we don't want that. What can we do to help this policy kind of take hold, and how can we promote that? And so definitely I would encourage you to utilize your student body. They have a very strong, powerful voice, and I think you'll find most students are going to be on board and can offer a lot of help. And that's all I have, Todd.
Great. Diana, we're going to turn it back to you.
Great. Thank you so much, Rachel, Carrie, and Ivan, for your comments today. We appreciate you sharing the successes at Oklahoma State University in creating and supporting a tobacco-free environment. We've collected a number of questions through the chat box already, and we'll be going through those at the end of the panel presentation. I also want to let participants know, because there have been a number of questions, that the webinars, including the slides and audio, will be available on ASTHO and NACCHO websites in about 1 week. Now I would like to introduce our next speakers. Karen Hill is the Tobacco Education Coordinator at North Arkansas College. Her academic background includes a BS in Communications from the University of Texas at Austin and a Master of Studies in Environmental Law from Vermont Law School. She is currently focused on coordinating the Community Tobacco Prevention and Cessation Grant from the Arkansas Department of Health, a CDC tobacco settlement program, through the North Arkansas Partnership for Health Education, a partnership between North Arkansas College and North Arkansas Regional Medical Center. Sam Martin is the chief of the newly formed Department of Public Safety for North Arkansas College, where he has worked since November. Before joining the college, he retired from his position as the chief of police for the city of Harrison in Arkansas, where the college is located, and has 30 years of experience as a police officer. Please remember that if you have a question for one of our speakers, you may post it in the chat box on your screen at any time during the webinar. Karen and Chief Martin, I turn the controls over to you.
Thank you, Diana. And I'm hoping everyone can hear me all right. The North Arkansas College and, let's see if I can do that. North Arkansas College and the North Arkansas Regional Medical Center put together an organization known as North Arkansas Partnership for Health Education in their foundation. And as that agency progressed, it became the organization that took over a lot of community activities for the community and college, and as also for the hospital. We work with a number of volunteers. The North Arkansas Partnership for Health Education started out with 3 employees and began looking for grants to fund a number of programs, and they also started a number of revenue-generating programs to help students move into medical fields. As we began looking for grant programs, we took advice from the Hometown Health Improvement Coalition. Now, every county in Arkansas has a Hometown Health Improvement Coalition, and ours in Boone County did a survey to determine what kinds of programs the area needed. They came about because Arkansas was ranked as one of the lowest health-wise in the United States. I think we were either 49 or 50 out of all the states in the United States. And these health coalitions were put together in order to help improve those rankings. What they came up with was a number of things that they then reported to the North Arkansas Partnership for Health Education, also known as NACCHO. And one of those things was to work on tobacco, because they found out that tobacco was one of the big health indicators. At the time, I believe we were about 1 in 1 in 4, 1 in 5 people in Boone County and the surrounding areas use tobacco. So we began looking for a grant, and we came up with a grant from the Department of Health here in Arkansas. The current rendition of that grant is my program, which is the Northwest Tobacco Education Network. And there are a number of other programs that now have grants. There's a Circle of Life program that focuses on teen pregnancy. We also have a drug prevention and resource center, and we have just ended a healthy lifestyle called Healthy Kids, Healthy Ozarks. That was a 4-year grant that centered on lifestyles as well. As a community grantee, we get money from the tobacco settlement money that comes out of the Center for Disease Control. We also work through the Arkansas Department of Health, and of course that's an agency under the Arkansas State Assembly. Basically, we have a four-pronged approach to tobacco. We want to prevent initiation. We want to promote quitting. Eliminating exposure of secondhand smoke, of course. We also wish to identify and eliminate tobacco-related disparities among population groups. And we've discovered that the college is a location where we can do almost all of those at once. Because of the 18 to 24-year-old population, initiation is preventable at this age. Most people don't start smoking after the age of 25, so doing what you can in this age group is very important. Promoting quitting among the adults and youth, we have, as part of our tobacco policy, information on cessation and directing students to the Arkansas Tobacco Quit Line. We also have, as part of the NACCHO offices, a resource center where there can be different cessation materials available for the students and staff. Eliminating exposure to secondhand smoke, of course, that is one of the major things that happens when you have a tobacco-free policy is you eliminate that secondhand smoke that occurs. And then finally, eliminating tobacco-related disparities among population groups. The population group in this area is actually the rural, low-income, and white populations. And as it turns out, that is the population that uses a lot of smokeless tobacco. And so we've included that and have included that in our policy from day one. As you can see, we are in the business of changing social norms. In the Boone County area, which is where the little red dot there is, that's where Arkansas, the North Ark College is, in Harrison. And in Boone County, we have a 1 in 5 adults in Boone County, also as in Arkansas and the United States, use tobacco in one form or another. Just below us in Newton County, it goes up to 2 in 5. That is a very rural area, and as you can see, this area is where most of our students come from: Carroll, Boone, Marion, Baxter, Searcy, Van Buren counties, and all of them have a fairly high, relatively speaking, tobacco use. And so changing the social norm was one of the initiatives that we were working on when we put the policy together, and it is still one of the things that we focus on. Now, North Arkansas College has 4 campus sites. There are 3 in Boone County, 1 in Carroll County. There's 400 full and part-time staff. This includes contract personnel, and there's, as of the fall semester, 1,978 students. We have 1 officer and 1 vehicle among all those, and Officer Martin, Chief Martin, is here with us today. And so, like as in Oklahoma, we have enabled our faculty and staff and our students to bring any of the enforcement issues to the attention of our Chief Martin or others in the area. And it is pretty well understood that the campus is tobacco-free. It has always been tobacco-free. We did add e-cigarettes in the last year, and that came about as part of our open communications process at the college. We have a number of ways that students can communicate with the faculty, the staff, the administration, and the president of our college actually received a Twitter from a student who began asking questions about e-cigarettes. And as the president of the college did her research into it, she became a large promoter of inclusion of e-cigarettes into our policy, and it was included in this year's printed copy. So if Stan would like to say a few words about enforcement, then we'll go over some of the policy and how it works.
Well, we are a new department, and actually now I have another officer working with me. I have him on an evening shift, which helps. We have not encountered a lot of resistance to the tobacco-free policy, with the exception usually of visitors. When we have a large ball game or something like that, tournaments, then we'll have some problems. Most of that is people that don't realize that we are tobacco-free, and kind of a word to the wise, and they've so far been very cooperative. We will occasionally have students get out in the parking lot or in their car and try to kind of hide out and smoke. We do have property owners around one of the campuses in particular who will let them cross the line and stand there and smoke. But by and large, we don't have a huge problem with enforcement. Now, being a new department, we have not come up with the penalties, if you will, for being caught on campus smoking or using any other form of tobacco. But we are working on that. But as I said, so far, it's been a matter of a word to the wise, and folks have been pretty cooperative. We did have one issue with e-cigarettes. We had a student that was just adamant about, they didn't hurt anything, it was not tobacco smoke. And I went and printed a copy of the state law and said, hey, here you are. You can't use them on the campus. And after that, I had no more problems from that student at all.
So in 2005, we put our policy together, and that was a year before the state went tobacco-free in public spaces. That was a result of the fact that this office, the NAPI offices, moved from an off-site location to an on-campus situation. And when they moved on-site, they pretty much said we needed to have a tobacco policy on campus, and so it was initiated and started based on the fact that we were training about it and having it as part of our community outreach. And if we were asking the community not to use tobacco, the college said, well, we won't either. And that's how that started. We incorporated the Surgeon General's recommendation regarding any form of tobacco use, active and passive, the smokeless and the smoke-free, or the smoked tobacco and the smokeless tobacco. Part of that was based on the fact that we knew that it was a rural population that we were with the students. In 2010, we adopted the 2009 legislation out of Arkansas stating that the schools will have comprehensive tobacco-free policies. Ours was already fairly comprehensive, but we made it even more so at that point. Initially, the policy was for 100% tobacco-free, and in 2010 it went campus-wide 100%. So that meant cars, vehicles owned by the college, it meant the parking lots, every event. We also do the sales and our investors, as did Oklahoma. In 2014, as I said, we had the addition of e-cigarettes, and that was, I believe, student-led, but championed by the president of the college. The policy is for all facilities owned or leased, all vehicles, sidewalks, parking lots, landscaped areas, recreational areas. It covers lectures, concerts, sports events, graduations, conferences, administrators, staff, students, visitors, all times, all items and all merchandise, no sales, no samples, no sponsorships, no gifts. We publicize cessation, including the Arkansas Tobacco Quit line, and we also have the Resource Center, the Health Resource Center, for research and help with our student and faculty and staff. Now, fines are stated at $100 to $500, but as Sam pointed out, with the involvement of an on-campus enforcement, almost all of our policies are being evaluated to determine what appropriate fines and citations should look like. Did you have anything else, Sam?
No, not really.
And with that, I'll turn it over to Diane. I'm sorry we went a little bit over, but close.
Thank you so much, Chief Martin and Karen, for your comments. We really appreciate you sharing the great work that's happening at North Arkansas College. We'd like to now introduce our next speaker. Joshua Prasad is an ORISE Fellow with the Department of Health and Human Services in the Region 3 Office of the Assistant Secretary for Health, where he advises on chronic disease prevention through the Let's Move Cities, Towns, and Counties Initiative and the Tobacco-Free College Campus Initiative. Josh received his Master's in Public Health from Drexel University and his Bachelor's from Rutgers University. Josh, I will turn it over to you.
Well, thanks, Diana and Erica, for putting on this fantastic webinar, and thanks to all of you for participating. And a special thanks to the previous speakers who were just enlightening us about their great work that we're seeing on their campuses individually. At a more collective level, I want to talk to you today about the Tobacco-Free College Campus Initiative, or TFCCI. We're looking to take the best practices and help new campuses adopt strong, comprehensive policies. We're also working with campuses that have existing policies to help strengthen them and improve issues around compliance and enforcement and much more. Just a little history. We actually formally started just about 2 years ago as a partnership between the University of Michigan, the American College Health Association, and the Department of Health and Human Services. Pictured here are the current and then leaders of the organizations, including our director to the left, Cliff Douglas, as well as our former Assistant Secretary for Health on the right, Dr. Howard Koh. With the projection that more than 1 million current college students will die from tobacco use and the understanding that the age up until 26 is the time when individuals are most susceptible to start smoking, Dr. Koh made it his mission to improve the health outcomes related to tobacco use, especially in these youth populations and on college campuses. We've seen some pretty astounding progress since the inception of the TFCCI. There's been about a 78% increase in the 20-plus months that the campaign has been active, with over 1,300 100% smoker tobacco-free campuses all over the country. A 100% tobacco-free campus is exactly what it sounds like, a school that has a policy that doesn't allow tobacco use anywhere on campus, no exceptions. We work with campuses to develop these strong policies because we believe, and we've seen both with case studies and anecdotally, that stronger, more comprehensive policies work to reduce smoking and tobacco use on campus. And you can see here that just about 10 years ago, there were very few fully comprehensive smoker tobacco-free policies around the country. When we started in 2012, there was definitely some great progress, and then with since our inception, we've seen about 600 more campuses adopt these comprehensive policies. And while, of course, we're focusing on the broad spectrum of tobacco-free campus policy, we do have a few special focuses this year and in the coming months to help specific communities and groups reduce their problems related to smoking. With you all as state, county, and city offices and their partners and colleagues, the focus on these slides represent opportunities for us to partner with you at those levels to accomplish similar goals. There's definitely a lot of overlap in what we do and what you guys are doing in your offices. For example, historically black colleges and universities offer a special opportunity to target outreach to a population that suffers proportionally worse health effects. According to the Surgeon General's report, African Americans are more likely to die from the leading 3 causes of smoking-related death: heart disease, stroke, and lung cancer. African American men are at least 50% more likely to develop lung cancer than white men, and the risk for breast cancer in women and the death from breast cancer is disproportionately higher in African American women who are former smokers or who had significant exposure to secondhand smoke. With 106 HBCUs across the country, we're looking to help them implement effective tobacco-free policies to help the next generation of African Americans be tobacco-free. Similarly, there are 32 federally recognized tribal colleges and universities in the United States. Surprisingly, or perhaps not, these institutions serve a large population nationally, around 30,000 full and part-time students. These universities are essential to their communities, maintaining Native American culture, languages, and traditions. We need to work with these great institutions to help continue the sacred traditions of Native American cultures while still working to improve their health outcomes. And finally, one of our last focuses that I'll talk about today anyway is community colleges, who are an often overlooked population in that they don't necessarily represent any one single population. Community colleges offer the opportunity for everyone to achieve higher education, paving the way for future success with all walks of life. With this mentality, we want to partner with community colleges, our partners at the Legacy Foundation, who's going to talk later on in this presentation, and all of you on preventing tobacco use on these campuses as well. As a tobacco-free college campus initiative, we offer several resources for our campuses and partners. A lot of this is centered around our website, www.tobaccofreecampus.org. There's a screenshot of it right on the screen, which we've set up as a one-stop shop for tobacco-free campus policy. Here you can find key resources such as model policies, peer-reviewed studies, and how-to guides to help you succeed and get started or continue with your tobacco-free policy. I encourage you all to explore more on tobaccofreecampus.org when you have a chance. We're also quickly expanding our social media reach and presence through Twitter and Facebook, Instagram, Tumblr, YouTube, you name it. Take a second to like or follow us on these accounts, and you can stay up to date on the most recent in tobacco-free campus policy. You'd be surprised, there's actually a lot happening day by day. We regularly provide updates about new campuses who've implemented policies, as well as news and events, information happening in the world of tobacco and higher education. Speaking of events, another resource we provide is our series of webinars and connecting you to our partners events as well. We have 2 upcoming webinars that we're involved with that we'd love for you to know about. As it happens tomorrow, our partners at the New England Tobacco-Free Campus Coalition with our New England office are putting on a webinar about communication strategies, cessation services, and other important tools to help improve compliance with tobacco-free campus policies. On October 7th, we'll also be hosting our own webinar for regional challenge opportunities within the TFCCI, which I will explain more about in a second. The webinar itself will have a special focus with those community colleges with participation from existing community colleges and our partners at the Legacy Foundation. If you're interested in either of these webinars, we'd love for you to sign up. Go ahead and to tobaccofreecampus.org. There's a sign-up link right there for the October 7th webinar, and there's information on how to sign up for the New England webinar tomorrow on the page as well. The challenge opportunities that I talked about are really two sister challenges that stem from the Tobacco-Free College Campus Initiative based on your geographic location. Campuses in our Region 10, that is Alaska, Idaho, Oregon, or Washington State, are eligible for the Fresh Air Campus Challenge. Campuses in other states are welcome to sign up for our TFCCI, or Tobacco-Free College Campus Initiative Challenge. They're very similar. They offer a structure for adoption of 100% smoke or tobacco-free policies to help campuses work their way through the process of implementation. Much of our criteria aligns with the best practices we just heard about before and what our partners and colleagues, like the folks at the Tobacco Control Legal Consortium, talked about before. When campuses reach successful implementation, or if a campus already has a policy, we recognize you with a certificate and a digital medallion to reward you for your dedication to campus health. Our goal is to provide technical assistance to campuses throughout the country and help develop strong policies that prevent tobacco use and help smokers quit. If you're interested in this, you can find out more on our website or join us for that webinar on October 7th. There'll be plenty of information there. The link for our website is listed right here on the slide. You can see that a lot of our resource is really focused on our website. But do not hesitate to contact me with your ideas and how we can work together. We want to explore and connect with campuses in your areas, your regions, and connect them with your resources and ours, and really help make the next generation tobacco-free through collaboration. Thanks for your time. Just as a reference, here's a list of our resources where we're available online. I look forward to your questions at the end of the webinar. Thanks again.
Thank you so much, Josh, for sharing these excellent resources on tobacco-free college campuses. The information that you shared was very useful to us in planning for today's webinar as well as executing it. So thank you for your contributions. Now we would like to reintroduce Maureen O'Brien from the Public Health Law Center to offer some additional thoughts on creating and supporting tobacco-free environments in colleges and universities. Maureen, I turn it over to you.
All right, hello, I'm here again. I'm going to talk a little bit about enforcement and really just sort of reinforce the messages that we've already heard about the successes that happened at Oklahoma State University and North Arkansas College and also around the country. We're going to start talking about enforcement, but really I think that the word compliance might be a little bit more useful to think about. You know how there are some rules maybe we really only follow because we think we might get caught. Okay, so speeding might be an example for some of us. But most rules we follow because we agree with them, right? We think that they serve a good purpose in our world. Maybe stealing is one of those examples for most people. You wouldn't do it even if there wasn't a rule against it. You just don't think that that's a good thing to do. So enforcement is really a whole lot easier when most people are on board, when they would follow the rules even without a risk of getting caught and getting a fine. So you want to think about what does that start with? And partially, well, it starts with good communication. People need to know the rules in order to be able to follow them. So back to that, who, what, when, and where. People should know those things about the policy. One campus I heard was actually including in their acceptance letter in the package that said, welcome to our school, information about the fact that they're tobacco-free. So right away when someone is accepted to the school, they learn that this is something that, that they're going to be participating in when they go to school there. It's going to be a tobacco-free campus. And that way people know that sort of from the very beginning. The other thing is clear signage and clear boundaries so that people know if they're just walking through the campus, they'll see a sign and they'll know that that rule applies, and they'll know sort of where the rules apply. Maybe a map would be helpful to send out to people so that they can see sort of where exactly the boundaries of the campus are if it's not the type of area where it's completely clear what the boundaries of the campus are. Another one, and then maybe this is sort of basic, but remove the ashtrays so that there's no sort of mixed messaging. And maybe put quit line or cessation information at the location where the ashtrays used to be. These sorts of things might support a policy and lead you towards a sort of voluntary compliance with the policy. The next thing is the big one. We've talked about it a lot today, tobacco cessation support. There are people who are going to struggle with their efforts to quit. And you sort of want to be very supportive of them and help them through this process. I know that one campus I was speaking with was very focused on not coming off as anti-smoker. And they had, I think, buttons that said, we love our smokers and we want them to live a long time. So, not being sort of anti-smoker, but being supportive of quitting smoking. Some campuses have quit days. Maybe they schedule events around a New Year's resolution or the beginning of the semester or right before finals to kind of promote everyone's quit attempts and help people work towards those efforts. And a lot of times people take multiple times to quit. And so giving them a lot of opportunities to be sort of part of a campus event where everyone is quitting helps people quit. So the next thing we really want to think about is community support. As we've heard earlier today, student groups can be a huge ally in getting a policy passed and getting people sort of behind that policy. And you maybe want to think about student groups that have sort of a natural fit between what their mission is and the smoke-free or tobacco-free policy. So maybe a student group focused on health, or maybe a student group that's focused on the environment and the tobacco litter aspect. Maybe they could organize a kick butt campaign where they go and collect cigarette butts and show sort of the impact on the campus environment. Also, student groups focused on social justice might be interested in helping support your tobacco-free campus policies. You really want to have community support from your leaders in the academic as well as the athletic community and just the general school community. And you want to think about neighbors as well. We've heard earlier today talking about, there were some concerns about what the impact will be on the neighboring properties around the campus. And one thing that might help would be to sort of reach out to the neighbors ahead of time and say, we're going forward with this campus policy, and can you let us know what your concerns are? Can you let us know what would help you sort of assuage those concerns as we go forward with this policy? Maybe you have an email address or a phone number where the neighbors can call and say, we're having a problem with this specific location. And then you obviously need support from your enforcement agents. So if it's police, if it's campus security, if it's facilities management, it can be helpful to get them on board early and have them involved with the policy development sort of from the beginning, partially because they're going to know a lot about what works and what doesn't in other aspects of policy enforcement, and they may be able to help you generate innovative solutions. You maybe want to set up trainings and empower people to feel comfortable speaking up to violators and sort of help them facilitate compliance. You may also want to identify some of your hot spots and monitor those locations where the violations are likely. And then sort of as your last step, you can think about sanctions and tickets. But that's sort of the final tool once you have all of those other pieces in place. Then you can think about the really sticky violations where it's just it's not coming around just based on community voluntary compliance. And let's see. So that's kind of the lessons we've learned today. Once again, this is my email address and our website, which looks like this: www.publichealthlawcenter.org. Thanks.
Thank you, Maureen, for all of your comments today. We really appreciate you sharing such valuable information on creating and supporting tobacco-free environments in colleges and universities. So before we move into our Q&A session, we just want to take a brief moment to share some resources that are available from ASTHO and NACCHO that support state and local health departments who are doing tobacco control work. So ASTHO has several resources on our website that may be helpful for states. ASTHO has released 2 tobacco publications. The first is a comprehensive tobacco control guide for state and territorial health officials, and the second is a booklet highlighting recommendations about smoking cessation strategies for women before, during, and after pregnancy. Both publications include examples of the work several states are currently doing in these areas of tobacco control and prevention. ASTHO has also written comment letters on proposed tobacco control regulations, including issues like menthol, e-cigarettes, and the Trans-Pacific Partnership Trade Agreement. ASTHO also convenes the ASTHO Tobacco Issues Forum, which is a work group that's currently chaired by Dr. Ed Ellinger of Minnesota under the guidance of our Prevention Policy Committee, and it's comprised of members and staff from key affiliate and partner organizations. This group serves as an opportunity to share tobacco control activities and resources, identifying opportunities to speak in a collective voice, and examine the overall picture of tobacco prevention and control in the states. So on your slide you have the address where on the ASTHO website you can access these particular resources, and then you'll have my contact information as the last slide of today's presentation. And I'll turn it now over to Erica.
NACCHO also has a number of resources that can be used by local health departments to support their tobacco prevention and control efforts. Our webpage is listed in the presentation and is a good place to begin looking at our resources. NACCHO maintains a searchable online toolkit containing tobacco resources from across the country, including guides, fact sheets, and model policies. And coming later this year, NACCHO will release an updated version of its guide called Program and Funding Guidelines for Comprehensive Local Tobacco Control Programs. And finally, you can contact NACCHO through the tobacco email address or my direct email address that is provided at the end of this presentation. Additionally, we would like to share just a few updates from Legacy. The Latino College Health Initiative has released, or is about to release rather, a new report that highlights a groundbreaking research on tobacco use, attitudes, and perceptions in Latino subpopulations of college students. So that should be very informational. And in early October, Legacy will release details on how public community colleges may apply for $5,000 grants to advocate for, adopt, and implement 100% smoke-free or tobacco-free policies. So keep an eye on that and check out their website. Those applications will be due on November 6th. If you have questions and have not already typed them, you may do that through the chat box. We already have about a dozen questions in the queue that we'll start working through, and we'll spend the remainder of our time for the call on those questions. So presenters, perk up your ears because we may be calling on you to answer a question. Let's see. First, we have something that was applicable really to both Oklahoma State and North Arkansas College. For either of you, and actually why don't we start first with Rachel and Carrie, have you continued to develop any community support through your office that you can share?
In terms of community support, I would say probably the greatest example would be our involvement with a tobacco use coalition that is community-based. It's actually county-based, if you will, so it addresses and covers all cities in Payne County. So that's the continued support that I think would fill your example of community involvement.
Great, thank you. Karen at North Ark, how about you? Do you have any interactions with the community that you continue to build to help implement and enforce your policies?
Not necessarily to continue to support our policies, but we have an awful lot of interaction with the community in health-related aspects. For instance, we work with the North Arkansas Medical Center here to work with their groups. There's a diabetes group, for instance, that's meeting this week, and we will be talking to them about tobacco and tobacco use and some of the resources that are available to them. And then with our one of our other programs through the NAPI offices, it's on teen pregnancy, and we meet with both the persons, the people who implement the program, and the clients twice yearly to go through and talk about tobacco, and then the program administrators are trained in the 3A method. We were talking at Oklahoma, they have the 5A, which is more for physicians, but for our program workers, they use the 3A method, which is simply to ask, advise, and refer their clients. And so I think, although we don't work with them on our policy issues, we do outreach into the community.
Great, thank you. Karen, if I can keep you on the line for a moment, I'll ask you to kick off the answers to the next question. Currently, with your campus-wide policy in effect, do you have any trouble with cigarette butt litter that has posed a problem?
Yes, we do. One of our issues is the tobacco use in the parking lot. People get out of their cars and toss their butts somewhere between their car and the door. And of course, our policy covers the parking areas and it covers vehicles. And so we do find a good number of butts hanging out around those areas, and it is a constant problem. We do have signage about the campus being tobacco-free as you enter the parking areas, so we've tried to head it off that way. And then another way that we're working on that problem is to start using a survey for new students coming in to ask them what they know about the policy and how they feel about the policy to get their input on policy issues. And then we will use the results from that survey to initiate some additional communication, pinpoint where we need to make that communication and how we need to make that communication.
Thank you. For Rachel or Carrie, can you comment on any problems with cigarette butt litter?
I would say in terms of cigarette butt litter, referring to what we'd already briefly mentioned, is the adjacent properties was an issue when the policy was first implemented, and we just addressed those. An example being we have a religious organization that houses a student center just adjacent, ironically enough, from a department on campus that has a high incidence of tobacco use. So we ended up with some litter on their property that needed to be part of our responsibility to help address that issue. So we put in receptacles, certainly wanted to address that in an appropriate manner. We didn't want that spot to just move, so we worked with that organization, making sure the environment was cleaned up, and as well that there were receptacles for disposal of cigarette butts. But on the campus per se, there has not been a significant cigarette butt issue.
Great, thank you. Let me keep you on the line for a moment now and ask if you have any specific suggestions for e-cigarette talking points. I know that e-cigarettes are included in your policy, and are you having to do any special work around that to be able to make the policy clear to students?
It's relatively new that has been a part of our policy, so we have not had specific educational issues or dialogue with students. Our perspective in terms of including e-cigarettes is, or our talking points, I guess you will, would be that the lack of regulation of the products that are used in your vaporizers and your e-cigarettes, and the true lack of research on potential health impact not only to the user, but those who are exposed to the vapor. And so those are the two primary talking points that we use when we are having dialogue, but it hasn't been really a significant issue that we're having students that are challenging the inclusion of those type of products in our policy.
Great, thank you. Karen at North Arkansas, I have a new question for you. Obviously your policy has been established for quite some time, and you told us a little bit about the organization that you work with, which is affiliated with both the university and the hospital and a number of organizations. Where do you receive funding for your marketing, promotion, education campaigns, anything around tobacco prevention and control?
The funding comes from the CDC. It's part of the tobacco settlement money. Arkansas does devote nearly 100% of those monies toward not just tobacco education, but health education in general. It's pretty far-reaching how far those monies go, but about a third of it comes to the tobacco grantees, of which I'm one. And we use marketing from the CDC, we use marketing from the state, and then we develop some of our own marketing locally, this is why I have to get the surveys done with the students to show exactly what kind of communications are necessary on campus so that I can create specific marketing for the student population and the visitors, especially visitors right now, but also the staff and faculty, so that everyone comes to a good understanding of just what is included in the policy and why we have the policy.
Great, thank you. Rachel and Carrie, I offer the same question to you. What are your primary sources of funding for your activities?
In terms of funding, primarily, it originally initiated with a TSET grant, as I know that's consistent with a number of universities. The remainder of the funding just really depends on what type of processes that we are a part of. If it's more of an educational process, that might come out of our University Health Services and their Health Education Department. We also have a Serotonin Wellness Center that contributes funds to support tobacco cessation programs. We also have support from sponsored programs that will assist with programming as well as marketing. So it's not specifically one department or division at Oklahoma State University, but it's cross division wide.
Great, thank you. I want to address a few legally oriented questions to Maureen now. We heard that North Arkansas College actually prohibits use of tobacco products in vehicles when they're on property. Do you have any comments about policies on incorporating personal vehicles and maybe any of the hurdles involved with that?
Yeah, sure. So I think one of the things you want to think about is where is the vehicle. If the vehicle is on your property or in your parking lot, then I think it's likely that you have the authority to regulate what happens in that parking lot if it's inside the vehicle or outside of the vehicle. Obviously, if it's a vehicle that's driving down a public street, things are a little bit more complicated, but I think usually what we're seeing is that we're talking about a parking lot that is part of property belonging to the campus.
Great, thank you. Here's another one for you, Maureen. How do you address public roads or things that are in the public right-of-way in terms of incorporating into policies and enforcing those areas?
So there's a couple different ways that you could think about it. One way would be to see if the city or the county that is responsible for the road would be willing to sort of help you out and pass a policy that it covers all of the area, including that road. Another thing to think about is if you are dealing with employees or students, you probably already have policies that regulate what these people are allowed to do during sort of their work day or during their school day or when they're associated with the campus, even if they're not physically standing on the campus. And so in those situations, that type of policy would probably be able to cover that person even if they're crossing the street. So you might already have a lot of that in place in your campus policies already.
Great, thank you. I've got two more questions for Maureen. One is, do you have any recommendations about dealing with businesses that operate on campus? Some things, for example, you might have a Starbucks or a Subway, and how do you work with those situations? I don't know if you've had recommendations based on the technical assistance you have worked with throughout the country.
Yeah, I think the first thing you probably want to do is get someone who's got a copy of the contract that you have with that business if they're operating sort of leased space with you, and read it over in detail, and maybe there's some opportunity when you renew the contract, or you can renegotiate and say we'd like to add a provision that incorporates our campus rules. That's sort of some of the more technical legal aspects of what you can do, but you can also sort of approach the business like you would anybody else and say, we're interested in going tobacco free. We know that you are sort of you're on our campus and people like to go to your business, and can you help us out, and can you be a voice and a leader on this issue? Because we believe you care about our students' health too, that kind of thing, and that may be very successful as well because a lot of businesses do like to have sort of the goodwill of the students.
Great, thank you. I'll actually leave the questions there for Maureen, and then I have one more question to pose to both educational institutions. Maybe we can start with Oklahoma State University. How do you measure tobacco use on your campus?
This is Carrie. We actually have a couple of methods that we've utilized in the past. Before the policy was put into place on campus, we essentially just utilized a generic tobacco use survey that we administered to a lot of the classrooms here on campus just to kind of get student perceptions as well as student actual use. Post-policy, actually since 2005, we've been utilizing the American College Health Association's National College Health Assessment, and we've continued to do that every fall on our campus. to kind of measure tobacco use. And this is specifically amongst students, so this is not taken into count faculty staff members.
Great, thank you. Karen at North Ark, how do you measure tobacco use at your campus?
We don't really measure it on campus because most of our students are not necessarily full-time. Most of our faculty are not necessarily full-time. No one lives on campus. And so the population of our campus becomes a part of the population of whatever county they live in. And so we rely on those stats from those areas, the CDC studies on adult tobacco use, and we also look very heavily at what's known as APNA studies, which are studies of students coming out of high school in the local area to see what is happening as people come out of high school. We look at those and we look at the adult populations, and that's simply because we're not a live on campus, nor are we traditional in the terms of a lot of full-time staff. Now, I did see a question about whether the signage includes vapor or the use of the word vaporizing, and I just wanted to comment on that because we don't use the word vapor in any form or fashion. We have made a conscious decision not to, because vapor has the connotation that it's just water, and we recognize that that is not the case. It's an aerosol, and it contains nicotine, which is a tobacco product, and so we have taken the stand that we are tobacco-free, and that includes e-cigarettes.
Great, thank you, Karen.
And this is Diana again. I want to thank you all for joining us today. As we mentioned earlier, you will be directed immediately to an evaluation at the conclusion of today's webinar. Please take a few minutes to complete our survey, as it really does provide us with some useful information for our future projects. ASTHO and NACCHO would like to thank the CDC Office on Smoking and Health for sponsoring this webinar. We'd also like to thank our speakers, Maureen O'Brien, Rachel Schreffler, Carrie Pratt, Ivan Phyllis Amy, Karen Hill, Sam Martin, and Joshua Prasad. A recording of today's webinar will be available on our website for the next few days at the web addresses that are shown on your screen now. And we hope that you will use this webinar as a resource and that you'll share the link with others once it's available. If you have any follow-up questions about today's webinar, please don't hesitate to contact the teams at NACCHO and ASTHO respectively. And we want to thank you all for joining us and enjoy the rest of your day.